Hello and good afternoon, friends. Karibu sana to all our friends from East Africa and namaste to all. I'm your host, Himanshu, joining you again, along with the very bright Irene, who joins me from Kenya. Well, guys, be ready. We are going to talk about love life, not yours or mine, but in general. Who doesn't love sex? Well, some would accept it and others would shy away, but the reality stays the way it is. We all live with the belief that our sex life can only be affected by stress, lifestyle, and age. But you may be surprised that there is an invisible enemy that prominently interrupts with our sex lives. And that quiet killer is diabetes. For all those who thought diabetes affects just your heart, nerves, eyes, etc., think again. It also affects your sex organs, your sexual drive, orgasm, and much more. A large majority of people would sweep their bedroom issues under the carpet. That's obviously not the solution. The solution is to share, to talk, and discuss with your partner as well as with your doctor. Irene and me are making this easy for you today. Dr. Lakhani, endocrinologist and diabetologist at Zydus Hospitals in Ahmedabad, India, will be addressing some of pertinent concerns and those questions which are usually not asked in public. So Dr. Om, please accept our sweet welcome to today's session, right? And as we go ahead, I will hand over the floor to Irene and I will join you back towards the end of the session. Irene, it's all yours now. Please start.
Thank you very much, Himanshu. Karibuni sana. And as he said, my name is Irene and my role is very simple. I try to empower you as a patient and I want to make you an expert patient. And on this forum, we help to answer questions that you don't really want to ask, but you want to know the answer. So, and he said, today we are talking about love lives, which is a skeleton in the closet, which we are trying to pull out. So, if you have any questions, we are going to leave an email address that you can be able to send the questions to us or type it out if you feel courageous enough. So let's start. Dr. Om. One of the questions that people have, before we even talk about the sex life and how diabetes affects it and our love life. So tell us, what's the essential information we need to have about diabetes, whether we have it or not? What should we know about it?
Yeah, so I think, to start off, first of all, good afternoon, everyone. And, thank you for making me a part of this patient education initiative. And I strongly support the initiative that, our patients need to be empowered. They need to be empowered to ask the right questions and to get the right answers and to get the best output of from the healthcare system in which you live. So I think to start off, what we really need to know about diabetes is that diabetes it's not one disease, it's a spectrum. Okay, so on one hand of the spectrum, you have the type 1 diabetes, which is generally more commonly seen in younger age group, seen in children, seen in teenagers, young adults. And this is the diabetes which was previously known as insulin dependent diabetes, where we use multiple doses of insulin, so on and so forth. And the other end of the spectrum is the type 2 diabetes, which is the more common form of diabetes, which typically occurs in adults. And apart from that, you have the other forms of diabetes. You have pancreatic diabetes, you have certain drugs which can cause high sugars, and you can have other rare forms of endocrine disorders which can also lead to diabetes. Now, the key point here is that diabetes is a systemic disorder. So it in fact affects the entire body, right from your hairs to your toes. Okay, so every system, every part of your body can be potentially affected by diabetes mellitus. And I remember in medical school we used to draw a little diagram of a person And right from the top, from the hairs to the bottom, we used to point out every single organ which can be affected by diabetes mellitus. So I think the major point I'd like to really, emphasize here is that diabetes can potentially, if not kept under check, can affect every single part of your body. And it's not something which is just isolated to your eyes or to your kidneys or to your nose. You can have a multi-system involvement with diabetes.
Thank you very much. Sometimes I was just, and Himanshu has been sharing a lot of statistics and we've been looking at it. And, one of the things that really made me take a step back is that, we don't really know what the statistics are about diabetes. And it was really scary to see that we have about 46% of diabetes that is undiagnosed. And we have people walking around, not knowing their diabetic status, if there's such a thing. And one of the saddest things that happened is during the COVID pandemic, we did lose a doctor who had diabetes and she didn't even know. And it's one of those conditions that was making the whole management be different. And you can imagine if we have medical people who don't know that, how much more the common person who's just, out there. So, this is me to you who's watching, make time, go and just get to know what is your status in terms of that. I think it helps. So the next question that I want to ask is, so we know, as you have said, diabetes it affects the whole body from the hair all the way down. And when you type in side effects of dealing with diabetes, you'll see everything about neurology, the heart, and all this. They'll mention sexual health, but then it's, an afterthought. So that's what we are trying to bring to the limelight. Can you tell us how diabetes affects the organs and how then this links to people's love lives and beyond that? Yeah.
Okay. Yeah. So, when we talk about diabetes and the sex life, though it may be an afterthought for, medical textbooks or for journals or for, articles, it's a very important aspect of the day-to-day life of a person who suffers from diabetes, and when we're dealing with a disease, which is a chronic disease, chronic meaning which is going to be around for a long period of time, we need to also look into the factors like how is it going to affect the person's occupation, how is it going to affect the person's life, the day-to-day dealings, how is he going to drive his car if I give him a particular medicine, how is he going to go to his work, if he works in a factory where he's at risk of injuring himself, can I give him an insulin which can lead to low sugars? So there are many aspects of life which you need to, as doctors and as patients, need to understand and work together to make a happy sort of a journey in diabetes. So, as far as coming to the topic of the sex life, now let's keep the male sexual function and female sexual function separate for now. As far as the male sexual function is concerned, overall, there are three major issues which happen with diabetes. So one is the problem with erection, that is known as erectile dysfunction. The second is reduced sex drive, which is known as low libido. And the third aspect is premature ejaculation. That's one of the major. In fact, the more we deal with patients in outpatient, OPD basis, we often realize that premature ejaculation is one of the major sexual problems, not only in diabetic patients, but also in a lot of youngsters across the country. And then you have, female sexual dysfunction. So, young females who have diabetes can have menstrual irregularities, because of insulin resistance. We all have heard about PCOS. Perhaps someday in future, we'll have another session on PCOS as well. So PCOS is one of the pre-diabetic forms, so PCOS often can lead to diabetes in future. And women with polycystic ovarian syndrome tend to have the cycles which are longer. They tend to produce more male hormones, that is the androgens, that is the testosterone levels tend to be higher. So they can have, a more facial hair growth, more acne over the face. And, it also leads to problems with intercourse. So it can lead to vaginal dryness, which can lead to painful intercourse and so on and so forth. So these are some of the issues which women face as far as their love life is concerned, and their association with diabetes. And one thing which is common to both male and female is that diabetes massively increases the risk of developing fungal infection in your private parts, right? So the fungal infections are very common. In fact, and like you talked about the point that people need to be diagnosed with diabetes much earlier. I think one of the important aspects of being diagnosed with diabetes early is that if you develop some kind of a fungal infection in your genital areas, that's one of the early telltale signs of diabetes. So if you have that, if you have whitish discharges, if you have a fungal infection which is very difficult to treat, you will obviously are likely to pass it on to your partner as well. You need to check yourself for diabetes. That is one of the early signs of diabetes that you really need to sort of get it sorted. So I think this is sort of a broad overview of how diabetes actually affects the sex life. And that's for doctors, it may not be that important, but for patient, it is often the center of the life. We heard about divorces which happen because of this. We heard about the patients, mental state being affected, and a lot of issues also being affected because of these problems.
Yeah. And that's true. That's actually what I was about to ask you. And because I'm thinking, how many people actually walk into your office and be like, okay, I'm having this problem. Can you help me? Despite being a patient with diabetes that you're managing. Because of the way our society is, people shy away from talking about these things and suffer silently. And because it's such a core part of our lives, everything else doesn't work. And you're wondering why. So is there like tips that you can give people about how they can approach the subject so that the next time they visit the doctor, they can be able to lay it on the table and not suffer silently?
Okay, I think that's a great question. Often, and this is very common for, I think, as a culturally from in both India and Africa and Asia and Africa, I'll say. We tend to have a lot of family consultations. So when I'm seeing a patient, I'm not seeing the patient alone. I'm seeing the patient's mother, the patient's perhaps the mother-in-law,
Yes.
the son and the daughter, and
Yes.
Perhaps a neighbor also who is part of the consultation. So you have this entire crowd who sits there.
Of people who have come.
Oh, yeah. So a lot of people, I think it's great for empowerment, no doubt about it. But at the same time, there are certain private discussion which a doctor can have with the patient, which often gets lost in the, the poor lady is not going to talk about her sexual problems in front of her mother-in-law, right? Or in front of the children. That is one of the problems. So, often we sometimes, doctors tend to have this little bit of sense that, the patient wants to talk about something, that this consultation is not complete. The patient does want to address some problem. And at that point of time, we often ask the patients, the attendants, relatives to just step out to the, outside for a few minutes. And then, the patient often opens up with their problems, which they want to talk about. Sometimes the entire crowd moves out, and then somebody goes for billing and somebody goes for some tests and so on and so forth. And the patient walks in back and says that, sir, this is one more thing I wanted to discuss about. And, then we make them sit, we talk to them in private. So I think the onus does not just lie with the patients also, it also lies with the doctors that, if this is a problem which in every diabetes patient, this issue should be addressed. This is part and parcel of diabetes management, and at some point of time during the consultation, there has to be a moment where the doctor brings this topic up, and this is something which can be discussed frankly and openly between the patient and the doctor. And as far as the patient is concerned, I think it's a very important thing that the patient should not shy away. It is their right to ask about these questions. It is their right to know about it. It is their right to and sometimes patients feel that I don't want to bother the doctor about these issues. These may be silly issues, but that's not the case. And in fact, the sexual problems with the patient often also give certain hints to the doctors. There are certain clinical cues which you get. In fact, they say that a diabetic male, and this is something very interesting, and those who are listening to this, please listen to this carefully. They say that diabetic men who have erectile dysfunction, they are more likely to have a heart problem, right? So sometimes we often ask the patients also that do you have an erectile problem? It's a 40-year-old, 45-year-old male we ask them, if they say yes, not only would we correct the erectile problem, but we'll also ask them to get some cardiology tests done. We'd like to get a ECG, echocardiography, perhaps, CT coronary score or something like that done. So, it's a two-way street. I think both the doctor as well as the patient really needs to talk about this. And I think in the current century, it's not a taboo anymore. But I think, I do feel that people are a little uncomfortable talking it in front of their other people. And I think, a little bit of privacy may be useful there.
Yeah, definitely. I mean, I've learned something about, erectile dysfunction being related to heart disease. And so therefore, that's something that anybody would want to rule out because it comes with a whole baggage of other things. So the next question is, so if a couple has diabetes and they are trying to conceive, can it affect them? And if that is a chance that it can affect them, is there anything they can do to make it better?
Yeah. So again, this question needs to be addressed from both the male and the female point of view. Talking about the female point of view, like we discussed, diabetes, type 2 diabetes, often these women tend to have insulin resistance. And because of insulin resistance, their periods, their ovaries are not functioning perfectly. So there is no regular ovulation, So that, females tend to have ovulation every cycle. In women who have insulin resistance, they don't have a regular ovulation. So because of that, their chances of fertility are much lower and they tend to have, infertility, and that's a common issue. The second is, as far as the males are concerned, again, for the males themselves, often there could be problems with low sperm count. So diabetic patients tend to have a lower sperm count. Again, they tend to have erectile problems and so on and so forth. So it does affect both the couples. Also, the problem as far as the females are concerned is that if they are poorly controlled, if the diabetes is not well controlled, and if they do get pregnant, the pregnancy is going to have a lot of complications because there are very limited oral medicines which you can give during pregnancy. So you're compelled to use insulin. And, again, with the use of insulin, there'll be frequent checking of blood sugars. There'll be often highs and lows, and if things are not corrected, so if the mother's diabetes is not well corrected, it can also affect the fetus. It can affect the baby. That can lead to, the babies are larger in size. There is known as macrosomia. The babies tend to be, larger. That can lead to, more complications during delivery, and also, sometimes post-delivery also the child can have problems. So the best solution to this, and there's a couple who often come to us, we tell them that, we need to first work. So before you plan for your pregnancy, this has to be a planned pregnancy. It cannot be an unplanned one. We need to first work on your blood sugars. We need to keep your diabetes under control. And if we can, perhaps lose a lot of weight, right? So sometimes weight loss corrects the insulin resistance. It improves the ovulation. That itself can lead to pregnancy. Also, weight loss, improves the blood sugar control. And also, the pregnancy is much safer with that. So this is something as a sort of a broad tip, I'll tell you that if you are a couple who are or both of them are suffering from diabetes, I think, one of type 2 diabetes, one of the best things you can do is have a planned pregnancy and try to lose weight before you plan your pregnancy, because that itself is going to help you a lot.
Wow, that's a lot of information right there. I mean, I'm sitting here just thinking, the other day we were talking about, the causes of, infertility and all that. And, I mean, it doesn't take long to just go and get tested and get to know what's my status in terms of diabetes, because it could be one of those things that's making, things difficult. And, that's also something that weighs down on a lot of couples trying to have babies, because that brings a lot of psychological issues. So my last question to you is, for postmenopausal women who then suffer from diabetes, what can you tell them that will help, make it better? Because I know postmenopausal, you come with a lot of, there's a lot of other hormonal issues that are going on. But if you're also diabetic, what else? Is there a special way to handle it? What can we do? What can they do to make it better?
Yeah. So I think, a lot of women get diagnosed with diabetes for the first time during the postmenopausal period. It's something very interesting. In fact, estrogen and the female hormones tend to have some amount of protective effect as far as diabetes is concerned. So generally, we tend to see, women having a peak of type 2 diabetes after the menopause. That's a common time where, in fact, a lot of women who come with postmenopausal issues or who have hypothyroidism and are postmenopausal, we often check their blood sugars, and a lot of them turn out to have diabetes. So it's first of all, if you're postmenopausal, it is very important to get, think of it as a new era and get yourself checked for diabetes, because this is a point of time where often diabetes is very common. So that is something, you need to be aware of. The second issue is, as far as postmenopausal women is concerned, and little tip I'll give you, what I've observed, I'll tell you, this is what my observation is. Postmenopausal women, they suffer, there is, I would say, some form of a midlife crisis, something similar to what males also suffer in their 40s and 50s. The women are also going through that phase. And at this critical juncture, they often lose support from their family members. The children, dismiss this off, saying that, a mom is always like that. She's always grumpy. She's always, in bad mood. And the husband says, they're married for a long time and just, ignores the wife, altogether. But this is an emotional aspect, it's like a new birth altogether. And, that lady really needs a very good amount of emotional support. I think that is very important. And often they feel alone, they feel left out. They are not, made part of decision making in the family. They are just, taken for granted, I think. And, that is one of the major, pain you feel, for them. I often feel that, family members, and this is what I often, if you have that family consultation, it's a great time to counsel the children who are there, the young guys, 20 in their 20s and 30s, we tell them, look, your mom needs help, your mom needs your support. She needs emotional support. She doesn't need any kind of medical support. She needs a emotional kind of support, which really needs to come with it. So I think, apart from hormonal therapy, which is indicated in certain women, I think a lot of love and support is something which really helps and takes it a long way.
Okay. Love and support. Got it. So I'm going to hand over to Himanshu, because I'm sure he has a lot of questions that he would want to ask you.
Yes, it's been quite interesting to know a lot of facts, there are a lot of things which small things that we ignore, we really don't care for. So we just, as you mentioned, that it's not just about medical treatment or medicines, it's also a lot to do with the emotional support. And I think that's important for every one of us. So thank you, Dr. Om. I would take you on another ride of questions. I have my own set of questions to ask. So I would start with something which is more related to men. So are men more prone to diabetes-related sexual dysfunction as compared to their women counterparts?
It's difficult to say whether they're more prone to it, but at least, their problems are very much apparent. The sexual dysfunction tends to be there. There are names. That's the interesting part. You have, for every little type of male sexual dysfunction, you have a name. But for female sexual dysfunction, it's just female sexual dysfunction. That's the problem. So, I think, for men, there are, like we discussed, they tend to have low libido. They can have erectile dysfunction, and they tend to have, premature ejaculation. All the three of them are actually, the risk is higher in diabetes patients. One of the reasons, and I think one of the critical aspects of erectile function, is that, erection actually depends on small blood vessels, small to medium-sized blood vessels, which really, inflow the blood in the penis. And, diabetes is a disease of small and medium-sized blood vessels. So diabetes and a poorly controlled diabetes leads to dysfunction in the cells which line these blood vessels, that is known as endothelial dysfunction. So the cells which line these blood vessels do not function as well. They do not constrict and dilate at the right way it should. And because of that, these men tend to suffer from an erectile problem. And like I said, the best, I think, a physiological test for, and this is also mentioned in actually textbooks as well, how do you assess somebody's endothelial function? How do you assess somebody's small blood vessels? There are two ways of doing it. One is looking through their eyes, checking their retina, and the second is to ask for the sexual erectile function. And if these men complain that they have erectile problem, that means, like we discussed, they are more likely to have other diabetes-related complications also, and also more likely to develop cardiovascular problems. So I think that's one of the simplest tests we can, we don't need an expensive piece of equipment, just a simple history. Do you suffer from erectile problem, which you did not have earlier? If the answer to that is yes in a diabetes patient, that's for me a telltale sign that this person needs a more thorough evaluation as far as the heart is concerned.
Thank you. This was very informative, and this also allows us to get onto a self-diagnostic level, at least at a basic thing. When you know that you are suffering from these problems, you can also assess yourself for something which is additional, like maybe a cardiac issue that's underlying, which we don't know about. Next question is something which has been asked by many of friends whom I know. Now, how the disease in like type 1, type 2 diabetic patients, if they suffer from any kind of a sexual dysfunction, is it dependent on the kind of diabetes or on the type of diabetic dysfunction that they suffer from?
You mean to say, is it different in diabetes compared to non-diabetic individuals?
Yeah, it's about if they are suffering from type 1 diabetes and type 2 diabetes, how does it impact your sexual dysfunction differently, or it's almost the same?
Okay, so in a broad sense, it is almost the same. So whether you have type 1 or you have type 2, at least as far as the erectile problems are concerned, as far as that part of it is often similar. The difference really lies in the lack of libido. I think that's one area where there might be a difference in a type 1 and type 2. The problem about libido is that, see, when somebody tells to me that my libido is low, I have less sexual drive, for me, that's a sign that I need to check the patient's testosterone. I need to check the person's testosterone level, because testosterone is the male hormone which impacts the sexual drive. Now, what will be interesting for again people to hear physiologically is that the more weight you gain, the more the testosterone becomes, more likely you are to have testosterone related problems, right? So one of the things is that if you have insulin resistance, there's a binding protein which is known as sex hormone binding globulin, that level tend to rise, and what it does is it starts binding with your testosterone. So even though your testosterone level may be normal, the testosterone is not functioning that well in obese individuals. So that is one of the reasons where they tend to have a lot of lower sexual drive, and also if you see, they tend to have a lower muscle mass, and overall well-being is also lower. And interestingly, when they lose weight, right, you'd have seen this. You'd have seen a lot of people who lose weight, and their sexual drive improves, suddenly. Why? Because what happens is that the hormonal system often changes, and that free testosterone level tends to be on the higher side, and they tend to have more sexual drive. Again, something very interesting is that the fat which you have, the adipocytes, which are the fat cells, these fat cells convert the testosterone into estrogen. So that's a female hormone. So the more fat you have, the more likely it is going to be converted, more likely that your testosterone is going to be converted to estrogen. And that is, again, something that leads to sexual dysfunction in type 2 diabetes patients. So this is one differentiating factor between type 1 and type 2. Type 1 don't suffer from this because they're generally, of course, these days we see obese type 1 also, but generally type 1 tend to be on the leaner side, they tend to be on the more fitter, I would say, side, because they've lived with sort of a, being under a scanner of the healthcare system, and they always, for them, fitness is survival, and I've known a lot of type 1 who are athletes, because they take the fitness very seriously because their life depends on it. Compare that to type 2 diabetes, they generally tend to be middle-aged people, tend to be, have somebody who have ignored their health all through their life, and now suddenly wake up to the challenges of the new disease.
Right. Thank you very much. So if you want to enjoy more, it's time to lose weight. That's the message that I receive, at least from Dr. Om. Dr. Om, another question which would concern all our diabetic friends. In case they have a sexual dysfunction related to diabetes, is it reversible if they improve on their diabetes, if they work on the regime, if they follow what the doctor says, what are the chances that they can come back to normalcy?
Well, I'll say from my experience, unfortunately, it's not completely reversible in all people, right? That's the sad part of it. Hence, I think one of the key messages that I always give to patients, and like Irene said, actually, my conversation about sexual problems really start much before these people develop problems. That's a sort of a preventive aspect of it. So we see a lot these days, and Himanshu, you'll be aware, we see a lot of young diabetic patients. We see now, Irene, we see diabetes, type 2 diabetes people in their late 20s and 30s very commonly. Every day, every single day, I see about 3 or 4 30-year-old type 2 diabetic patient. And this makes me sad because they're, they're at the peak of their sexual life, and that is when they develop diabetes. And we often tell them that, look, you might not have a sexual problem now, but if you don't control your diabetes aggressively at this point of time, you are going to develop a problem, and that problem is really going to be very difficult to treat once it develops. So I think the best answer to this is prevention is the best cure, right? But if they do develop, sexual problems, if they lose weight, B, if they control their blood sugars, and C, there are of course certain medicines which can help. They can, improve upon their sexual dysfunction. However, to achieve what they had before they had diabetes is really next to impossible, and that is what the patients also tend to compare their sexual function when they were in their early 20s to what they have now, which perhaps that may be an unrealistic goal to really achieve, especially when the damage has really been done. So I think in that sense, I think the key message here is that if you're diagnosed, and like Irene said, I think repeatedly, I think it's very important to get yourself diagnosed early. So if you're diagnosed early, and if you're treated early, and if you're we do an aggressive treatment early and your blood sugars remain good, you can actually prevent the sexual dysfunction from developing at all, and you can enjoy a better sexual life in your prime.
Thanks for that. This would definitely help a lot of people and give an answer to those who cannot ask. The whole reason behind this session is there are many questions which people have. They don't know how to ask, whom to ask. Obviously, they would know, but they do not know how to ask. So we're just trying to help them.
I actually have one more question.
Yes.
Yeah. Another thing which is very concerning these days, a lot of patients, young or old, they use insulin pumps. Now, any tips on managing the insulin pump, especially during the intimate moments?
This is a googly, I think we have, Irene, we have the cricket tournament today, IPL, and I think, Himanshu is hell-bent on calling me googlies for this. So, the other day I actually had a debate with, not a debate, sort of a friendly banter with a colleague of mine from the UK, where we discuss about, lived experiences versus a doctor's own aspect. I often have type 1 patients who come and tell me that, doc, you learned about it, but I lived with it. So I think a lot of the times, and I think this is a question which is more of a lived experience kind of question versus a learned experience kind of question, but it's an interesting question. Answer is, well, the modern pumps actually, the tubings are pretty long. So I think, as long as, you're not into any weird forms of sexual intercourse, I think generally you should be doing fine. Also, I'll say, generally speaking, if the intimate session lasts for, let's say, 20-30 minutes, I think pumps can be sort of suspended for a few minutes, so that can be done. Of course, these pumps are often suspended when person is taking a shower, or when there's some, of course you have waterproof ones also now, but while maybe perhaps swimming and all that, you can suspend the pump for a few minutes. But having said that, I think you can have intercourse with the pump on. It's not a problem. A little bit inconvenient, I think, and sometimes people may find a little bit hesitancy, I have perhaps, but I think as long as the partner is very accepting and supportive, I think it's not a problem.
So you nailed it right. One has to be accepting towards the other's requirement, others' needs, others' conditions. So I'm very confident. In fact, positively hopeful that today's session will energize many people's bedrooms back to near normalcy. Please remember that good blood sugar control is the beginning of a fantastic love life, especially when you are diabetic. So
I think
don't
Irene
wait.
had a question you wanted to ask.
Yeah, Irene, you have any question to ask?
Yes, I actually have one, which I'm sure that people would want to ask. So this is me asking on behalf of the male counterparts, because I see a whole market around sexual performance, medication, and stuff like that. Now, when I think of that, then I think of dysfunction. I think of the heart issues. Dr. what do you think? Is it okay for diabetic patients who are already having these kind of problems, erectile dysfunction, to purchase those drugs? Will it affect them differently? Because that's something that out there, they're using it, and for some people it ends up the wrong way. Is this one of those reasons why?
Yeah, so if there are certain medicines which are approved, and then there are a lot of these off market, I think alternative products.
I know them.
There's a big market for them, right? We'll talk about, as far as the alternative products, I would say a strict no. And that's no for both diabetic as well as non-diabetic individuals. A lot of these things contain heavy metals which can cause long-term damage. I remember when just after I'd finished my MD, I used to work for a short time in a hospital in Hyderabad, and we had this a gentleman who continued to have fever and liver problem, and he kept getting admitted all the time, and we could simply not figure out why this was. And ultimately, after a long time, we realized that he was taking some alternative product, which when we got it analyzed, it had a lot of heavy metals, and which when we looked at literature, that was known to cause the kind of problem he was suffering from. And that's one of the problems which often is a challenging issue. As far as there are certain medicines, these are known as phosphodiesterase inhibitors. It would be popular as Viagra in the United States and also in India, Panagra, and there are other brands for it. And then of course you have Cialis and all that. These are approved medications. The challenge with these medications are that these have to be strictly used after the doctor's evaluation and prescription. They cannot be used without that. Like you very rightly said, especially if there are certain medicines, when combined with Viagra or Cialis, can lead to fatal problems, complications, which can sometimes, lead to deaths also and accidents also. So I think the important thing is that if the doctor does a clinical analysis and rules out certain problems, rules out potential drug interactions, these drugs can be safely used in diabetic patients, but only after the doctor's evaluation and only after the doctor approves the use of it. Without that, using it can be potentially life-threatening, right? And especially in diabetes patients, because they, like we discussed, if you have an erectile problem, you are more likely to also have a heart problem, which needs to be first evaluated, and then any medication needs to be prescribed.
Yes, I needed you to say that, because I know that we have a lot of people who are watching who are contemplating or are already using them, and it's a totally new era of complications. So thank you, Himanshu, for letting me ask that one last question. Over to you.
So all the friends who are watching our show today, don't wait. There are doctors. Please seek advice. Please seek professional advice. Don't experiment on yourself. Don't go by hearsay. And what is more important is eat healthy and exercise. That will definitely help you. It's not going to harm you any which way. And yes, before we leave, do join us back again, the same time, same place. Coming Saturday, we are going to talk to you about something which is very interesting to everybody, alcohol. Well, not just alcohol, it's going to be alcohol and its connections with your liver disease. So please be there and do leave us your comments. We will be sharing our WhatsApp number and email IDs in the comment section. For all those who do not want to write comments, there will be many. So you can get in touch with Irene or myself, whichever way you feel is fine. Your secrecy is assured. It's going to be maintained.
Yeah.
And it said that golden words are not repeated. Well, this golden session is, however, available on Zydus Hospitals' social media platform and patient support services Facebook handle, just in case you could not join us. So goodbye, and remember to keep your masks on, keep washing your hands, and stay healthy. Take care, and thank you very much. Asante sana.
Thank you.
Thank you. Thank you,
Bye.
Irene. Bye. Bye, Himanshu.